It was surprising to me how simple it was and how quick my recovery was. I am so happy with it. It's exactly what I wanted. I still look like myself, but I just feel more awake and open-eyed. Guys, I debated on whether or not I even wanted to share this. I kind of thought I wanted to be one of those who just like pops out looking brand new, pretends nothing happened. But I'm cutting my eyelids off tomorrow. My eyelid, I just have like all this extra skin here that like covers my eyelid. Like I don't have a lot of eyelid space and I love that look. Like obviously I want to be able to wear like winged eyeliner and eyeshadow, and like I'm gonna document the process. So this is what they look like before. Essentially I'm just gonna get rid of this like little bit of skin that covers my eyelids, so it should look like more similar to that. I'm going to Dr. Daniel Barrett. He's the same one who did my boobs, and you guys know I had like the best experience with him. So I was like, if it ain't broke, don't fix it. Went straight back to him and I said, cut him off.
Yeah, that little.
I just have all this extra uncircumcised eyelid. That's
yeah?
What it is.
Okay. Wow. All right. All right, so our plan, we're gonna remove the extra eyelid skin, you guys. Basically, our goal is to kind of make it look like she's a little more awake. One of the big complaints that she had was that her makeup was kind of getting stuck in that area. So we're gonna improve that as well for her. A lot of people actually get this done, and the key is to make sure that it's not visible. Believe it or not, a lot of people actually get it done and they just don't tell anybody because they come in here and I see it happening all the time. So we're gonna do that for her today, and thanks for sharing.
Yeah.
Cool. Just injected numbing medicine, and now I'm actually checking lid excursion. So of my excision, planned excision, I want to make sure that it doesn't open the eye too much. So the other thing we're checking with calipers is to make sure that our distance is fairly symmetrical, although she does have more excess on one side versus the other side. Injecting numbing medicine and a hemostatic agent to prevent bruising and swelling. So she's gonna wake up pain-free and minimal bruising and swelling. Okay, so we're done and we're just checking here. Okay, good hemostasis, a little bit of bruising, but you can see that we have nice equal symmetry from both of the skin excisions. Upper blepharoplasty, we removed the skin, upper eyelid lift. All right, so we did basically equal amount of skin excision, both upper eyelids. You can see where she has that extra crease and the extra skin. Again, not overly dramatic. You don't want to overdo this procedure. You want to do a very soft and subtle amount just to get the opening of the eye and prevent that extra skin from touching the eyelashes. Upper eyelid lift is really common. A lot of people get this procedure done. The key is to make it look very subtle, very natural. A lot of celebrities get this done and you don't even see the scar, okay? It's totally doable. If this is something that bothers you, let us know.
This is my day one blepharoplasty update, okay? I got it yesterday morning. This is technically like the second day, but this is what it looks like. It honestly looks really scary. It's like black and blue. I still have my stitches in, but zero pain. They prescribed like a true pain medication. I didn't even bother picking it up. I know most of you probably won't be able to see the vision yet, but just the difference between now and then, like I've never been able to see that much eyelid, and I love it. I'm so happy I did it. I feel like it's gonna look really good and natural once it's healed. Obviously this looks so insane, but same thing happened with my boobs. They were so extreme in the beginning that I like had a real heart attack, and now I love them. So I feel like I'm gonna love this too.
We're here at week 2, and this is what a blepharoplasty can look like at week 2. We have a little bit of swelling and a little bit of bruising left. Any pain or anything you're experiencing?
No pain.
Yeah, so other than the cosmetic appearance, this is no real limitations on work or going about your daily business. We're gonna switch over from the ointment that you're using to a scar gel. It's called Skinuva, it's what I recommend, and you're gonna put it on twice a day. So basically you're gonna take a little bit of this, put it on your pinky finger, and just kind of dab it here. Don't go up and down because we just took your stitches out, so you could open your incision. So if you, so if you rub your eyes right now, not a good idea. So that strength doesn't really develop until about 4 weeks.
I am officially 6 weeks out of my upper blepharoplasty. This is what we're looking like. You can still see the scar. I'm wearing scar cream every night. I think they say it takes like around like 6 months or something for it to be kind of like invisible, but it doesn't bother me at all right now. Like I feel like just looking at me, you can't really tell. The reason I got it is because I wanted to be able to wear like more eye makeup, but after having it done, I randomly have felt so much better without makeup. It's like I feel like I don't have to wear a ton of makeup anymore, which is like literally the opposite effect of what I was going for, but I'm loving it. I have always been very heavy-handed with my makeup. That's no secret, but every day since I've gotten it, I feel like it's been like tinted sunscreen, blush, mascara, and I like feel so good, which is like, I've literally never felt that way ever. You guys, I know you're gonna hate to hear it, but I'm so happy with it. It was so easy and I love the results. It's exactly what I wanted. I feel like it's nothing drastic. I still look like myself, but I just feel more awake and open-eyed. If it's never bothered you before, then maybe it shouldn't bother you now. It is an option if you do have like very hooded eyes or if it impedes on your vision, or honestly, if you, like I did, just want to look a little bit more awake. I loved it. It was a very easy process. I'm not encouraging anybody ever to get plastic surgery, but I did, and I like it.
Well, we are, is it 4 months? 6 weeks?
7 weeks probably.
That's it?
Yeah.
I think.
Yeah.
I don't remember.
Oh my God. This looks like almost like fully healed.
I
Are you
really am
serious?
trying hard with it. I use the scar cream like a lot.
Yeah, okay, good. Yeah, it
And
shows.
the red light as much as I can.
Wow, it came out like perfectly symmetrical too.
I know.
I'm really shocked at that.
I love it.
Normally there's like a slight difference because you had that asymmetry to begin with, and the fact that it came out like this, I'm like really happy.
I'm happy because this has always been my like least favorite side of my
Yeah.
face, but this one I feel like is like perfect.
Good. So we switched your favorite side.
Yeah.
All right. Cool. I didn't know you could switch your favorite side. That's great. It's been about 7 weeks. You can see that the scar, this is beyond good for this amount of time. Normally we would expect to see a more noticeable scar. She's telling us that she's using the Scar Gel, which is great. If we come around here, look at the front, you can see that the symmetry is really perfect. I was actually shocked that we could actually get that much symmetry. She had one excess on one side versus the other, and we took more from one side. It ended up working out great, and now this is her favorite side. So we're really happy. We're going to continue scar management. It's going to go for another 4 months or so until the 6-month mark, and then we can stop doing that. But by that point, you probably won't notice a scar, and that's why I love a blepharoplasty. It's almost a no-brainer if you have extra skin there, because that scar doesn't really translate into something that's permanent and noticeable for most people. So if you think about it, you have extra skin, this is a potential result that you could have.
It was surprising to me how simple it was and how quick my recovery was. It was so quick for me. I think just a couple weeks later I was able to wear makeup and do my show, and it wasn't a big deal at all. I never had any pain. It looked a little bit crazy to start just because I'm a bruiser, but other than that, it was so simple and quick. I am so happy with it. I just feel better naturally.
Brooke is now 4 months out, and I've been following your social media. It looks fantastic. When you did your research, you obviously had a problem with the makeup and things like that, sticking in there, the extra skin. Now afterwards, were your expectations of what you wanted to get out of this operation, did they match what they were initially?
I specifically wanted to be able to do like winged eyeliner and have more like freedom with my makeup, but it's made me look so like awake, I feel like, that I've become more comfortable without makeup. So now I'm not even wearing
That's awesome.
as much makeup. So I'm just excited. I feel like I look happier even.
Well, it looks awesome. I can barely see your scar. Some people have this, you know, you don't have to be super old to have it. Some people have this extra skin, and if it bothers you, go ahead and do something about it. Check out Brooke's content. She has great, amazing content. And then if you're interested in blepharoplasty, please let us know and we'll reach out to you. Thanks so much.